Chapter 7 Blood Collection Equipment, Additives, and Order of Draw. Please take a moment to review the objectives. Alright, general blood collection equipment and supplies. There will usually be a blood drawing station. With the table for supplies, a special chair called the phlebotomy chair. There will be handheld phlebotomy equipment carriers and phlebotomy carts. Alright, gloves and glove liners should always be provided to you, and you should always use them, required by the CDC and OSHA when performing phlebotomy. New pair must be used for each patient and removed when done. Do not reuse gloves on multiple patients. More general supplies, you'll have access to antiseptics, which prevent sepsis, which is when microorganisms or toxins get into the blood. So usually 70% isopropyl alcohol. You'll have disinfectants, which are used to remove or kill microorganisms on surfaces and instruments. These are not safe for human skin. Hand sanitizers, alcohol-based rinses, gels, and foams can replace hand washing if hands are not visibly soiled. You'll have gauze pads, cotton balls, and you'll also have bandages. Biohazard bags and sharps containers. Venipuncture equipment. Most often you're going to use a tourniquet used to tie around a patient's arm to restrict blood flow. Should restrict venous flow to inflate the veins. You of course will have access to needles. They are sterile, disposable, designed for single use only. For single use only. There are some types of the needles and parts. Alright, the gauge of a needle is the diameter of the lumen. The higher the gauge, the smaller the diameter of the needle. Appropriate range for phlebotomy is 20 to 23, 21 being the most common. Evacuated tube system is a closed system in which blood flows through a needle inserted into a vein and then directly into a collection tube. Allows numerous tubes to be collected with a single venipuncture. Multi-sample needles. You will also have tube holders. Okay, evacuated tubes are available in different sizes and volumes. The size depends on the age of the patient, the volume of blood you need for the test, and the size and condition of a patient's vein. This says available in glass. I think it would be hard for you to find those available in glass these days. Alright, evacuated tubes have a vacuum within them, which is designed to draw an exact volume of blood into the tube. Additive tubes have a substance within them, an example being an anticoagulant. Non-additive tubes obviously have no substance added to them. Tubes are color-coded. The color of the stopper usually indicates the type of additive. Always make sure you're aware of expiration dates. These are examples of some of the evacuated tubes, color-coded. A syringe system, alternative for patients with small or difficult veins. The syringe system. Alright. You also might use a winged infusion set, also more commonly known as the butterfly. Effective for small or difficult veins on hands, elderly, and pediatric patients. The butterfly. You can have combination systems, which is a combination of the ones mentioned. Alright, so this is talking about some of the additives that can be in the blood collection tubes. Anticoagulants are substances that prevent blood from clotting. Two methods of preventing clotting, including precipitating calcium and inhibiting formation of thrombin. Types you can have EDTA, citrates, heparin, and oxalates. The ones you're going to come into common contact with most are the EDTA and heparin. Special use anticoagulants listed there. Antiglycolytic agents. These are substances that prevent glycolysis or the breakdown of glucose by blood cells. Sodium fluoride is the most common, and it preserves glucose for up to 3 days and inhibits bacteria growth. Clot activators. These are substances that enhance coagulation in serum specimen tubes. Thixotropic gel separator has a density between that of cells and serum or plasma. When centrifuged, the gel moves between the cells and the serum or plasma. This prevents cells from continuing to metabolize substances. Trace element free tubes. These are tubes made of materials free of trace elements. Trace element contamination, used obviously for trace element tests, toxicology studies, and nutrient determinations. And something you will be very familiar with throughout the course of your work is the order of draw. Order of draw is used to prevent carryover or cross-contamination. Cross-contamination or carryover can occur when blood in additive tube touches needle, or blood is transferred from a syringe into tubes. Order of draw presents sequence of collection that minimizes the risk for interference. Tissue thromboplastin contamination. For coagulation tests, draw a few millimeters of blood into another tube before collecting coagulation specimen. Microbial contamination. There are microorganisms that are found on your skin naturally, and these can contaminate blood specimens. Blood cultures are collected first in order of draw when sterility of site is optimal and to prevent contamination of the needle.